Okay, so I wanted to make this video to talk about what has happened to me during my journey into cancer, terminal cancer. Okay, how I've been treated by the doctors and what it's led me to do, and hopefully this will help somebody. Maybe not, maybe it won't help anybody, but just kind of as a record as to what exactly has been going on with me. I got sick in April. I didn't know what was wrong with me. I went to the doctor. I've been over this before. I'm going to do it again to kind of document what's going on. I'm going to leave this video up. So I got sick in April, and by May the 10th, I was admitted into the hospital with terminal cancer. Colon cancer, which is metastasized to my liver, to my lungs. I now have a dysfunctional liver, according to the blood analysis and all the other crap that's been going on the last 3 months. And still have not started any chemotherapy. They told me if I started chemotherapy, I would have around 2 years, approximately. That's the approximation with people in the condition that I'm in, the situation that I'm in, with all the analysis that they've done and all that crap. Approximately 24 months. Unfortunately, there's been so many things that have happened that have have stopped me from starting chemotherapy that it's almost divinely put in place for me. It's almost so many things have happened that it's just like someone is telling me, no, don't do that. And after all the BS that I've been through with these doctors, I mean, just a cornucopia of nonsense with these doctors, these cancer doctors that have been treating patients for God knows how many years. In my opinion, after 3 months of going through this process of being a terminal cancer patient, I've come to the conclusion that these people do not have my best interest at heart. That's the conclusion that I have. And I have talked to 20 different doctors. They've all given me a different analysis of what's going on. The head doctor, the guy that has been there for 45 years, told me that in the history of cancer, no one's ever had the condition that I have, and they don't have a path forward. They don't know what to do. They don't know how to treat me, and all this nonsense that I had to go tell my wife and the rest of my family that they don't have a path forward, they don't know how to treat me, because in the history of cancer, no one's ever been in the condition that I'm in. And it's just been stuff like that has led me to come to the conclusion that these people just do not have my best interest at heart. Damn, that's loud. Where's my controller's over there somewhere anyway. TV's loud. I was supposed to get chemotherapy on last Tuesday. They're supposed to start the drip, the IV drip, last Tuesday. But my wife had come down with a very, very bad case of an upper respiratory infection. She was coughing and hacking and gagging all over the place, man. And so I called the doctor, like, yeah, no, you don't need to be around somebody who's that sick, especially with an upper respiratory illness, because you've had pneumonia, and so you would be susceptible to something like that. So I said, well, okay, well, we're going to talk about it Tuesday. I got to go up there Tuesday anyway, so you got to clean my dressing and change this bandage and all this crap that I've had on my arm. And so I go up there, and we start talking about it, and they're like, well, just don't let her cough on you. And I was like, are you really telling me that? Are you kidding me right now? Are you telling me that it is my best interest to start this chemotherapy, reduce my immunity level down to 0, while my wife has a horrible upper respiratory infection that she's being treated by a doctor for, by the way. She's taking antibiotics and all this other stuff to try to, keep her from, getting pneumonia herself. And, they're just like, oh, well, it's just no big deal. And I was like, you know what? I have had enough of this bullshit. I've had enough of this. I've had enough of every time I've come up here, somebody has told me something different. Now you're telling me that I don't have any risk. First of all, my assessment is a 12 on a scale of 1 to 16 on being my infection risk. So I'm a 12 from a 16 to begin with. It's the reason they wouldn't put a port in my chest, because I was at high risk of infection, and they didn't want to have to go in there and do an operation to remove the port if they had to treat a blood infection again. That's why they gave me a PICC line, which, by the way, as you can see, I don't have anymore, because I told them to take the damn thing out and shove it up their ass. Because I'm sick and tired. I was sick and tired of the bullshit that those people were telling me. Every time I went in there, it was something different. And we're not talking about a third world country here, okay? We're talking about MD Anderson, okay? Cancer Hospital of America, okay? And I just, in my opinion, those people do not have, for whatever reason, my best interest at heart. And I was in there looking at those people while they were taking this PICC line out of me, because I said, that's it, I've had enough. I'm done with you people. You people are full of shit. You don't know what you're doing, or you're confused. I don't know what's wrong with you, but there's something that's wrong with the process that I'm going through, because I'm confused and you don't make any sense. And I'm a person that values, what's the word I'm looking for? I value when I can put the puzzle together and look and see what's going on. And I can't do that with these people, okay? Because every time I go in there, somebody tells me something different. And by the way, 3 months, they've treated me 2 times for blood infection. The first time I had Streptococcus, something was this blood infection was attaching itself to my heart valve and had damaged my heart valve. By the way, I feel that. That's something that I have noticed, and it's real. But okay, and then the second time they put the PICC line in, and they didn't treat it properly, and it got infected. Okay, they didn't do what they were supposed to do, and it got infected. So I got a different blood infection. So they've treated me twice for blood infection with antibiotics. That's all they've done to me. Nearly $250,000 fucking dollars. Nearly $250,000 fucking dollars for those 2 treatments. Okie dokie, you understand? You tell me that cancer is not a big fucking business. Guaranteed it is a big fucking business. And that's how they treat it. And here's my final point about that. Wednesday, I got a call Wednesday after I was at the hospital Tuesday getting this PICC line, and I was fired up, telling them I'm done with you fucking people. I'm going to go the homeogenic path, because I'm just as likely to die from the infection in the time allotted that I'm going to die from the cancer anyway. You understand? So it doesn't matter. I don't trust those people. I don't trust them. They have completely lost 100% of my trust. I don't trust them at all. But they called me Wednesday, and they said, well, Mr. So-and-so, you've been referred to us from Dr. So-and-so at UTMB University Hospital in Galveston County. I said, well, who is that? So what are you talking about? Who are you? And what are you talking about? And then they said, well, we've got an order here, and we was wondering if you could come in Friday to see the doctor, about what's going on with you. And I said, well, what's going on with me? She said, well, I don't know. We just got a reference from UTMB. I said, number one, I'm not going to UTMB. I'm going to MD Anderson. I'm a cancer patient at MD Anderson. So I don't know any of the doctors that you're telling me about here. I said, so what you need to do is you need to contact my doctor. I've said who he was before, but I'm not going to say it again. Dr. Blah Blah at MD Anderson, and then contact me again, because I don't know who you're talking about. I don't know who the doctor is you're talking about. I don't know who's referring me to whatever doctor you're talking about in another city somewhere. You know? And, you know, and the reason that I'm getting referred out of that place is because I won't go in there and sit in there for that 6.5 hour drip of poison that they're going to put into my body to try to shrink this cancer. That's the reason I'm being kicked out of this hospital, or kicked out of this medical, whatever you want to call it, you know, cancer, whatever it is, cancer hospital. They don't want to see me anymore because they can't milk my fucking Medicare anymore. Okay, they can't milk my Medicare for that 6.5 hour drip that they were going to give me, and then treat me for the poison that they're giving me while they try to shrink this cancer, which is not going to save my life anyway. So the whole thing has, what that guy just said, been one epic fail. Okay? The only thing they have been able to do is take the infection out of my blood. That would have killed me. They saved my life in that regard. The treatment that they gave me to remove the infectious bacteria in my blood saved my life. I'll give them that. That's true. But from that point on, it's just been a clown show, man. It's been an absolute clown show. And so I made them pull the PICC line out of my arm, and I'm like, you know what? I'll just do the homeopathic. I understand that they have pills that they can, some kind of chemo pills now that they can give you. If that can help me fine, if it can't, fine. I may be dead in a month. But that's better than walking around with a patch on your arm that you can't get wet, you can't sweat. So I have to sit in here with my little dog over there on the couch over there. I have to sit in here 24/7. I can't mow the yard. I can't work on anything. I can't do anything because I can't sweat. Because if I do, then this bandage is going to get soaked up with sweat, and it's going to cause infection and bacteria into my blood again. So it's upset me to the point to where I said, okay, that's it. I've made my mind up. I have an illness that's going to kill me, and there's nothing I can do about it. It's in God's hands. I'm as at peace with it as I can be. How can you be, 100% at peace with something that you know is fixing to kill you? So I don't know how long I have. I really don't. I don't know how aggressive this cancer is going to grow and begin to shut down my organs, because that's what's going to happen. But I just wanted to make this record and let everybody know how I felt about how MD Anderson treated me as a terminal cancer patient. Okay, it's just been an amalgamation of he said, she said, I don't know, and I don't care. That's how I felt being treated by MD Anderson here in Texas. I mean, maybe somebody's had a better experience than I have, but that's how I felt. The nurses and everything were pretty good. I had a couple of problems with a couple of nurses. That's just because they were, not well trained or didn't pay attention when they were being trained or whatever. So there were a couple of problems there, but for the most part, I give all the nurses and all the staff, really good marks. Hospital was clean, all that, but the doctors, man, they just don't make any sense. They just don't make any sense. You'll have one doctor come in and tell you something, and 30 minutes later another doctor will come in and tell you something else, and then 30 minutes later another doctor will come in and tell you something else. And some of them are looking at the same systems on your body. Some of them are internal medicine doctors, some of them are heart doctors, some of them are cancer doctors. But I'm talking about the cancer doctors. You'll have one cancer doctor come in and tell you one thing. You'll have another cancer doctor come in and tell you something else, and then another cancer doctor will come in and tell you something else. And you're like, what the fuck are you talking? You people don't make any sense. You contradict yourself every time you turn around. I went and told my whole family that I had no hope, that they had no way forward, they had no clue how to treat me, because in the history of cancer, no one has been in the condition that I'm in. That's what the doctor, the senior fellow at MD Anderson, told me while I was in the hospital, sitting there. That's what the guy told me. Come in and he told me that. And I was like, well, shit. You know, well, he can't tell you how long you have, 2 months, 3 months, a month. He doesn't know. So I had to call my whole family and tell them that bullshit. And it all was formulated around the fact that the growth that was on my heart was still there. Well, it wasn't still there, which we had all already confirmed that it wasn't still there. Yet he came in there and told me that bullshit anyway. So it's been a mess. It's been, I've just come to the realization that that I have to, in this situation, I have to put myself in God's hands, and I'm thankful for the life I've had. I'm very thankful for my wife. She's the best thing that's ever happened in my life. I'm thankful for my friends. I'm thankful for the position that I'm in today. I have a lot to be thankful for, and so I am. But I wanted to make this video and explain why I felt the way I do about how I was treated by MD Anderson here in Southeast Texas. I wouldn't recommend anybody go there for cancer treatment, not one person. They say MD Anderson is the best cancer hospital in the world. If that's true, then we're in real trouble. If that's true, then we are in real trouble. Because the only thing they care about is sucking your Medicare dry as fast as they can. That's what they care about. In my opinion, that's what's in their interest. I am not in their interest. Them treating me and trying to help me is not in their interest. That's just how I feel about it. That's all I got. Peace, and I'm out.